To be. Hi, everyone. I'm Dr. Carolyn Alexander. It's an honor and privilege to be here with my dear friend who makes me feel rejuvenated and always feel good when I bump into you. You bring good spirit and good vibes to me. Thank you so much. And uh, introduce yourself.
Hi, my name is Dr. Tamara ZumMallen. I'm a licensed acupuncturist, and I'm about one block over from Dr. Alexander's office. We worked together for about a decade, so I'm honored that she asked me to join her in this webinar today on fertility preparation.
Yes, I was born and raised in LA. I went to UCLA and for undergrad and med school and trained at Johns Hopkins Hospital. And I was inspired to pursue a career in infertility and endocrinology with Dr. Howard and Georgiana Jones at Johns Hopkins Hospital. And it's been an honor to work with such courageous patients and take every step together, through the journey. And I know how much you care too, Tamara. So it's so nice to work together. Um, and next slide.
Hi, everyone. I'm Dr. Tamara ZumMallen. I've introduced myself already as Dr. Alexander's neighbor. I am originally from Chicago, and I got my acupuncture degree in 2001 and went back into the doctoral portion of the program in 2012. Making my subject the effect of acupuncture on IVF outcomes, and just learned so much and wanted to form a best practice around the embryo transfer, and fortunately was able to come up with that and write that paper. My mom's very proud.
Next slide, yeah. So at Southern California Reproductive Center, we've been here since 1999. Our embryology team works diligently and are very dedicated to get us the best pregnancy rates. They're really the most caring individuals. We work closely with Dr. Suri, Dr. Danzer, Dr. Maxwell, and Miriam, our nurse practitioner. We have a sister office in Santa Barbara with a full embryology lab and team. We have an office in Pasadena as well as in Ventura. We had a Burbank office in the past as well. And now with telemedicine, it's helped us a lot to take good care of patients and get that initial visit set with the telemedicine so that wherever patients are, we can get the ball rolling to start to talk about ways to improve fertility and check all the important tests and work together as well. Next slide. Our embryology lab has well-experienced and certified directors. It has a double witness verification system. We were one of the first places on the West Coast to do vitrification or flash freezing of an embryo, as well as genetic testing for aneuploidy screening, which is for all the chromosomes, as well as genes, specific genes such as cystic fibrosis, Tay-Sachs, the early Alzheimer gene, breast cancer gene, sickle cell disease. And so we try to help people optimize the next generation in terms of protecting them from any genetic issues, especially if we know in our family tree that we carry specific genes. It's important to talk about it with your doctor. The EmbryoScope is morphokinetics. It looks at time-lapse video analysis of the embryos, and it has helped us veer away or towards an embryo that could be better than a different embryo depending on the morphokinetics of that embryo. And so we could talk about that a little bit later, but it's really fascinating and it's improved our awareness of what embryos are doing over the 7 days in the dish. Next slide. And today we're going to talk about fertility misconceptions, age factor. I'm an older parent, so I understand. I always tell patients it feels like that big step forward to take the leap to think about fertility. But it's important to understand your body, your physiology. You learn along the way things that can improve for your overall health as well. We'll talk about treatment options, the holistic approach, the whole person with acupuncture. Meet our team, and we're happy to answer questions in the chat. So feel free to send us questions. Sometimes we get a lot of questions, so we're excited, and they're really smart, amazing questions. So it's good to see. It really shows such awareness of the menstrual cycle and everything. Next slide. Next slide. Okay, so age, it does matter for men. Some people say it doesn't matter for men. We are seeing, since COVID hit, a lot of people realize that maybe they want to reevaluate their fertility and their goals for having a family. And so fertility does change in men after age 50. There's higher risk of epigenetic changes, which on your chromosomes, you get one from your mom, one from your dad. And so there can be methylation or acetylation or different histone compatibility and issues that pop up. So there's some uptick in epigenetic changes as men get older. In addition, what we do, especially encouraging men to avoid marijuana, vaping, hard alcohol, CBD oil, and things like that, to try to limit the exposures to things that could have an impact that may or may not be good on sperm quality and sperm dynamics so that we get the best fertilization rate. Optimizing the vitamin D level for men, as well as improving their body mass index, can improve things. Tobacco has the biggest impact on sperm motility, so it's important to remember that. And so it's a combination of egg quality and sperm quality. It's not just like we tend to think, oh, it's always the egg or the woman's age or something like that. The other misconception is infertility is a female issue. As I mentioned, about a third of the time we catch abnormal semen analysis where the concentration is less than 20 million per milliliter, or the motility is not as fast as we hoped, or the morphology, which is the shape of the sperm. All fertility treatments are the same. No, everybody's individual. Even thinking carefully through if they have a lot of stress after the fires, a lot of people were very amped up. We've been checking a lot of 8 a.m. cortisols because we're seeing that a lot of people are very stressed. And so we're evaluating the adrenal system. And so trying to tackle each of those things takes a little finesse for whether we're doing IUI, IVF, which protocol is the best. We learn from what your body's had. So if people have tried different protocols, we try to tune in. Can we understand what could go better, what did go well, and try to understand what we can do to finesse and get that better. Infertility is permanent. That's not true. I just had a patient who had severe male factor, and then I had him see urology, go on all these medications to improve spermatogenesis. We did IVF, we have good embryos, and then I said, take a little break from hormones and things, and they got pregnant naturally. So it does happen that we'll see, even in pretty interesting cases where we're worried that the sperm count's really low, it can improve with Clomid, HCG, lifestyle modifications. And so there's always hope. I'm always a believer that there's always a golden egg. So we try to focus on that. Next slide. As women, as we age, it is true that Mother Nature does change the egg supply. At age 35, the chromosomes in the mitotic spindle start to get sticky. And that's why as the chromosomes separate, when sperm's going to fertilize the egg, there's an extra piece of a chromosome or a missing chromosome that can occur. And so it's very important to recognize that as time goes by, the genetics of our eggs starts to change. And people always say, I did 23andMe and everything was normal, or I did the genetic screening and I was totally negative for those. Each egg has its own individual chance to have a complement of chromosomes that are healthy or not. And so that's different than specific genes like cystic fibrosis or Tay-Sachs or sickle cell trait. Next slide. Age factor in terms of the production of genetically normal eggs. As we get past age 35, the chances of a genetically normal egg starts to go down. At 40, it also changes. but we still have healthy genetics and healthy pregnancies in patients into their 40s. It just may take more tries than average people because not every month gives us the blessing of good eggs. And so we're trying to figure out which way and which protocol can get us the best outcome. Next slide. What is the definition of infertility? Under age 35 with regular menstrual cycles, it's 1 year of unprotected intercourse. Ovulation tends to be around day 14, but it's very, very important to have unprotected intercourse starting earlier because sometimes the egg pops out or ovulates earlier in a cycle, like around day 11. So we usually say to start to have intercourse day 9, 11, 13. If someone's period is really far apart, like 35 days apart, they may be ovulating a little later. And so it's important to make sure to have unprotected intercourse around the time of ovulation. After age 35, we have a discussion with patients after 6 months of trying, because as time goes by, like the genetics graph showed, the chromosomes start to change. And so it's important not to take too much time. If they're trying for 6 months, we may need to double check the fallopian tubes, talk about fertility, check the hormone panel and see what's going on, make sure the semen analysis is normal. Next slide. In terms of the medical history, it's really important to have your annual physical exam. We just caught someone who had a very early onset melanoma because I saw a little mole on her back when I was doing her exam. So it's important to get your annual physical exam. If you have a family history of anything specific, target those things. Have your pap smear up to date. If you're at the age of needing a mammogram, make sure to have a mammogram because once you're pregnant, we don't like x-ray. We don't like to do some of those tests, so it's good to have them under your belt and done before pregnancy. We do a physical exam, check your thyroid. We do catch goiters sometimes or enlarged thyroids. And it's important to evaluate the abdomen. We're always on red alert for looking for fibroids in the uterus or endometriosis or polycystic ovary syndrome. And we do a deeper diagnostic testing, and especially in patients who've had 1 or 2 miscarriages, because we may need to understand, is there any other factors like the immune system or blood clotting disorders or infection in the vagina, such as ureaplasma or mycoplasma, or trying to understand, is the miscarriage due to genetics of the egg or sperm, which is one of the most common causes, or is there other reasons that we could protect from for the next pregnancy to protect from a miscarriage? Next slide. If female testing is really important, so on the 2nd, 3rd, or 4th day of the period, we check a hormone from your pituitary gland called FSH, or follicle stimulating hormone, in conjunction with estradiol. We're hoping the FSH is less than 10 and the estradiol is 30 to 60. If the FSH is over 10, we start to try to understand why is that happening. That's can be a red flag for diminished ovarian reserve. If the estradiol is over 60, that can be an early recruitment of a follicle. So we try to understand why that's happening. In some of the patients who are exercising a lot or having calorie restriction, we'll see really low estrogens, and sometimes it's harder to get pregnant because if the estradiol is very low, that can be a sign of the lining of the uterus not being as optimized in ovulate at the time of ovulation. The hormone called anti-Müllerian hormone level is produced by the granulosa cells around the eggs. And we're hoping it's at certain ranges, and you can see them here. And that's your egg supply level. FSH can fluctuate from month to month, but we use it as a tool to understand egg quality. The ultrasound on the right shows the little circles. Each of those circles has one potential egg, and the egg is smaller than a grain of salt. And each of those follicles has a chance to make a bigger follicle that could grow with the medications that we use for ovulation induction or for stimulation to stimulate the ovaries for egg freezing or IVF for making an embryo. Next slide. The sonohystogram is a saline goes in the uterus. It hurts like a little small cramp. You can take Advil or Motrin or Tylenol ahead of time. We're trying to understand if there's any fibroids impinging on the lining, any polyps, any scar bands if you've had a DNC or a miscarriage before. We also sometimes can detect other issues that we see, sometimes adenomyosis, which is endometriosis in the muscle, where we turn on color Doppler and we can see a high vascular flow to the muscle. So there's certain clues we can get during this test. Next slide. Male testing is very important. We want the man to ejaculate 2 to 5 days before his appointment day so that we get a good volume over 2 milliliters, the concentration over 20 million per milliliter, the motility over 50%. And the morphology, we look at the shape of the head, the mid-piece, and the tail. And we want to see around 14%, but we worry if it's below 5%. And for example, I had a case where the patient had 0% morphology, and we worked closely with the urologist, and it was that some of the blood pressure medications he was on was impacting that. And we had to change the complement of medications, and then that improved. So sometimes it's small changes that can benefit us to get natural pregnancies too. And remember that around a third of the time we catch male factor. And so it's important to remember if we're doing all these tests on one partner, we have to evaluate a semen analysis, the genetics of the male partner to check for autosomal recessive disorders that can run in our families, as well as we like to make sure their vitamin D levels healthy. If they're having problems with erections or libido issues, I'll add a total and free testosterone in the morning, as well as thyroid, prolactin, estradiol, FSH, LH, because it's a panel, and sometimes we'll get a red flag that tells us he should quickly think to freeze some sperm, because some men, if they start to have hormonal imbalances, it may be important to recognize that the sperm needs to be saved as a backup plan, just in case the sperm count starts to shift. So that's important to talk about with your doctor as well. Next slide. In terms of options, there's egg freezing, sperm freezing, embryo freezing. There's intrauterine insemination, where sperm is placed in the uterus at the time of ovulation. Or there's in vitro fertilization. Surrogacy is common. Some patients have cardiac anomalies or uncontrolled lupus or chronic kidney disorder. Sometimes some patients are on medications where it's really tough. They can't carry a pregnancy because the medications can be quite harmful for the baby. And that's always important to think about. Donor eggs is used in some patients. We try really hard to get eggs to develop in them, but they have what's called diminished ovarian reserve or premature ovarian insufficiency, where the ovaries have kind of shut down and it's harder for us to get the ovulation to occur. And some people use sperm donors in same-sex couples, or if we can't detect any sperm on a semen analysis, and we've done a full panel to understand why. And sometimes genetically we can't produce any sperm. And so we can use a sperm donor as well in those cases as well. Next slide. IUI is where during the first part of the cycle, it's called the follicular phase of the menstrual cycle. You come in on day 2, 3, or 4 to detect which protocol to use, whether we want to try Clomid, that's been around since the 1970s. It's a tablet that you take for 5 days, or letrozole tablets, or injections called follicle stimulating hormone. We do monitor you through the IUI process to verify that the ovaries are making good follicles. Then we talk about a trigger shot and time when the sperm's going to be placed inside. For donor sperm, it's important to have the sperm arrive way ahead, so we're not scrambling to try to get the donor sperm here. So It's important to plan that out with the team. And then we check a pregnancy test 2 weeks later. During the latter part of the cycle, we sometimes support the early pregnancy with progesterone, which is a vaginal suppository that does help us in some cases where maybe there's endocrine disruptors or issues that cause the body not to have enough progesterone in the second part of the cycle. And so we boost it with vaginal progesterone. Next slide. The egg retrieval timeline. So I always say it takes a month to 3 months to prepare you. So you have to make sure to take the vitamins, avoid toxins, amp up your cardio exercise, think about acupuncture, try mindfulness, make sure to try to get good night's sleep if you can. And then you're going to get a baseline ultrasound to determine if it's an optimal cycle. You'll take the 10 to 12 days of ovarian stimulation. And then there's an egg retrieval. It's a 15 to 20-minute procedure under anesthesia. And it's a vaginal ultrasound with a thin needle guide that carefully gets each egg out in our facility. The lab is attached right here, and the lab cleans off the egg, finds the best looking sperm, and places the sperm into the egg, or we can dip the egg with 20,000 sperm to allow for fertilization. And then the embryo grows for 7 days, and the team in the lab can either test the embryo with genetic testing on the embryo, or they can freeze the embryo, or they can initially freeze the egg. Next slide. So this is an example of how we do the retrieval. There are 3 risks with the process: small risk of bleeding. There's the risk of hyperstimulation syndrome, which is where we grow a lot of follicles and each make a hormone that cause electrolyte shifts and can have a higher risk of blood clotting. And so it's important to understand your body. If the doctor says you have a risk for hyperstimulation, avoid white carbohydrates, avoid heavy lifting, really baby your body for that 7 days after, so that you want to be cautious for the ovary, heaven forbid, to turn on its blood supply for torsion. And so you want to be monitored closely. If you're feeling any chest pain, shortness of breath, anything like that, always let your doctor know right away. It's very important to keep them in the loop as well. Next slide. Embryo development. So this is an image of how the team prepares the embryo to do PGTA, pre-implantation genetic testing for aneuploidy. So they'll take a few cells off the perimeter to be able to look for the full complement of chromosomes, and that's called aneuploidy screening. And so sometimes this is important, especially as the age of our eggs goes higher, there's a higher risk of Down syndrome and chromosome problems. In addition, we can also use this tool to test for chromosome or aneuploidy screening, as well as specific genetic disorders, as I mentioned before. Next slide. This is the morphokinetics I was mentioning. And so the team in the lab can decide which embryo, based on certain parameters, is a little bit better than the other embryo. It won't change the destiny of the genetics of that embryo, because people say, is this going to benefit me to help me get a better embryo? No, it just provides information and may help us cross-check which one could be better than the other once we know the genetics, if you're doing PGTA. Next slide. Your turn. Yeah, good. And
That's
any
me.
questions? I'm happy to look through any questions. Thank you so much.
That's my Instagram handle. If anybody wants to find me on Instagram, holistic approach fits Beverly Hills Acupuncture. That's my one. I'd love to see you there. Acupuncture, mindfulness, nutrition, fantastic ways to enhance your assisted reproductive journey. Acupuncture, the reason that you have acupuncture while you're doing assisted reproduction is 3 different reasons. One, we want to get good blood flow to your ovaries and your uterus. And I think that's pretty self-explanatory with some local needles and some infrared heat. And the second reason is to influence your HPO axis. That's hypothalamus, pituitary, and ovarian axis, and how those organs and glands communicate with each other to produce hormones. Acupuncture and diet, very helpful there. And the third reason is to reduce stress by way of increasing endorphins and lowering cortisol. Acupuncture and diet, very helpful there. So when somebody comes in for a first session with me, that's what I do. Of course, there's an evaluation, and with all that information, I will pour over my nutrition books and come up with some do's and some don'ts and a grocery list that's specific to you and your partner. And if you don't mind me doing a shameless plug, I did write a book on fertility preparation. It's called The Fertility Book. It's now selling in 10 countries. So you also get a copy of that in your first appointment with me. So nutrition, I find that very, very important. And like Dr. Alexander was saying, it's the 90 days leading up to your assisted reproduction that's really crucial for you to be alcohol-free and watching the caffeine and really getting in your protein and your veg and your berries and healthy oils. And we'll get to that too. And mindfulness, incredibly important. There are sections in my book that give the reader the opportunity to form a mantra in the morning, so you have something to say to yourself all day. As you are when the mind starts to wander, and you can draw it back in. And one of my favorite ones, I give 21 of them, but one of my favorite ones is, I am confident in my body's ability to create and sustain life. And if you start to spin, if you start to spiral out a little, just bring yourself back to that thought. That's always very helpful. And also, I like the idea of a morning gratitude journal, just writing down the 3 things that you're grateful for. Some examples have been in my patient population is, my fertility team has my back. They're amazing. And my spouse cooks all my meals and they're delicious. And I'm getting such great sleep. So those are just a few of the things that people do put on their morning gratitude list. And then journaling at the end of the day, also very mindful. So next slide, please. We love the Mediterranean diet for fertility preparation. Plant-based foods. I want to add to that list right there. That says whole grains, vegetables, legumes, fruits, nuts, and seeds. I like to have olive oil on that list, as well as beets and berries. And why do we love the Mediterranean diet so much is that it's all-encompassing. There's a little bit of something for everybody. It's easy, it's anti-inflammatory, and wherever you go, you can find Mediterranean options. So at any grocery store, at any lunch spot, at any dinner spot, you will find those things. For proteins, it relies heavily on fish and seafood, with a lesser extent being poultry, and then even less extent beef. And in Chinese medicine, that's where all my training comes from. We don't like for you to have anything ice cold and frozen. So think about that when you're choosing your vegetables, that your salads aren't too cold, that you're choosing cooked vegetables instead. Now, folic acid, of course, we know if you've been in fertility any amount of time, we know that folic acid helps reduce the risk of neural tube development, neural tube issues in the fetus. So legumes, asparagus, dark leafy greens, and B12, fantastic for progesterone production, as well as uterine lining preparation. So B12 organ meats. The highest amount of B12 would be in chicken liver and beef liver. And you'll notice on that list that it's all animal product. So if you are vegetarian or vegan, you would want to supplement that. And something that you can think of too is nutritional yeast. That's one that's high in B12. And omega-3 fatty acids, fantastic for egg and sperm quality. And there we have salmon, cod liver oil, sardines, chia, flax, and walnuts. So there's something for everybody there. And I'd like to add to that list seaweeds like dulse and nori. That's also very helpful. So next slide, please. My favorite. I was just talking about this. Boost blood flow to the reproductive organs. Now, how many needles do you put in the abdomen when you want to do that? That's going to vary depending on where you are in your cycle. In my clinic, I do 2 to 7 needles in the lower abdomen. Balance hormones, influence the HPO axis, relieve stress, increase endorphins, and increase pregnancy rates by 16.2% during embryo transfers. That's true. If you do needle on the day of transfer, the chance of your embryo implanting goes up 16%. And next slide, please. Yep. Increase blood flow to developing follicles. Again, throughout the cycle, it's going to look different depending on where you are in your cycle. And you can start acupuncture at any part of your cycle. If you're menstruating, if you're in your follicular stage, if you are ovulating, if you're in your luteal stage, doesn't matter. Doesn't matter to me. Come on in, just jump in right where you are. Circulate the blood flow and get the uterine lining ready for transfer. Again, very important part of the IVF process is getting the uterine lining ready and regulating the menstrual cycle, again, back to the HPO axis and influencing the hormones there. Now, this is a good one, decreasing menstrual cramps. Keeping that woman active during the menstrual cycle is important. So having her come in and doing the handful of needles that we do in the lower abdomen to relieve the cramps, very, very important. Decrease hormonal headaches. That was my original reason of becoming an acupuncture patient when I was in my 20s, is because I had terrible hormonal headaches and I had such a good experience with the acupuncture curtailing those that I became a student. And support in first trimester pregnancy symptoms. I do have women come in during first trimester. If you are not sleeping, acupuncture is very helpful for that. Constipation, sometimes that extra progesterone will cause some constipation. Acupuncture, very helpful there. If you are just overall anxious, acupuncture helpful there. And of course, nausea, very helpful. Usually by second trimester, that clears up. People do still stay though for stress reduction. And in a third trimester, I think every single one of my patients comes back through to relax the low back, relax the hips, take care of the knees, start to get babe head down round about week 34, and then just prepare for birth in general. Next one, please. And decreased emotional stress for sure, increasing the endorphins, relaxing the patient, greater physical relaxation, shoulders drop away from their ears. Almost everybody falls asleep on the table. That's how comfortable you can get in acupuncture. And you do tend to breathe more deeply when you're lying on your back and you are able to stretch out and relax the jaw. The breath does become a little more easy to maintain, and they do get a good night's sleep. That's one of my favorite side effects of acupuncture, is that everybody sleeps better. And Dr. Alexander could probably attribute to this. We talk about sleep too being important. You want to sleep 7 to 9 hours a night when you are going through assisted reproduction, and that's where you rest and digest. It's where you rest and repair. It's where your hormones are produced. So that's very, very important. And a lot of times people are just grateful for the 30 minutes in the middle of their day to lie in a quiet room. It's dark. I have a nightlight on. The music is soft. It smells nice. The heat tables are heated. And just that opportunity to take 30 minutes to yourself in the middle of the day is very nice. First-time acupuncture patients sometimes feel a little high. That's true. Again, that endorphin high, and it puts you in a good mood. So I do hear patients say that a lot. Next slide. Practicing mindfulness. Yeah, take a break from the social media. It's okay to say no to events that you don't feel comfortable going to. Some of my gals don't want to go to baby showers, and usually the moms that they have to tell that to are very understanding of it. I think it helps to send a text, so you're not putting somebody on the spot to have a reaction at that time. That's a helpful tip on dealing with that situation, and sharing your feelings with your support system. Got to have that support system in place, a good spouse or maybe a trusted friend who's been through this before. Your IVF team is good, your acupuncturist is good. All of those people can support you during that time. And again, planning responses to uncomfortable conversations. Nobody wants their uncle asking them over Thanksgiving dinner when they're starting a family. And what I tell my patients is to say, we're keeping it private for right now, but when we have information, we're going to tell you first. And that usually gets a chuckle, and people can calm down about it. And trying mindfulness practices such as meditation, journaling, positive affirmations, setting the gratitude journal. Those would be my recommendations for mindfulness. What are your recommendations for mindfulness, Dr. Alexander?
I say whatever fear you have, write it on a paper and rip it up, because I
That's a good
notice
one.
like some of the patients I'll say like, oh, any questions, or what is on your mind? And it's things that we don't see day to day. I feel like I help a lot of patients, each week. And so it's like the day to day, we mostly see things, thank God, go smoothly.
Mhm.
But so in terms of what might be on your mind to tear up that fear. I also think, I mean, I like to tell people try to watch funny, silly things after the embryo's in, because sometimes people say I watch like a horror movie and I'm like, oh, you might get that fight or flight response. So try to like think of funny, happy things. But in general too, you have to have a support system. I feel for patients where they say, I didn't tell my folks, I'm too shy to tell my friends that I'm going through all this. Then I say, okay, open it up to me. I'll help you through this part. But and a lot of people tell me everything, but I think it's good to have a support system of a buddy system. I know when I was trying, I feel like definitely acupuncture saved me. I had a fibroid, it hurt. It was just this unbearable pain. And then it was magic. And I know it sounds, as a Western medicine doctor, it seems weird, but it really was a night and day experience for me. So thank you very much. But I think it's very helpful. I think also I had that flicker of faith in it, and I think that had that sparkle with that.
Mm.
Um, but those are my thoughts.
That's excellent. And what I tell my patients is like, if you're out of faith right now, if you don't have any today, I'm going to have the faith on your behalf. So just spill it. Let me know what you're thinking. And if you need to cry, this is the place to do it. And we're going to have a new day tomorrow. Sometimes the news isn't what you wanted that day, but you are one step closer to getting your baby. And sometimes you just need somebody to remind you of that. Next slide. Yeah, empower yourself through education. Rely on us. We'll point you in the right direction. If you need a support group, or if you are looking for a specific book on empowerment, or if you're looking for a specific book on good intentions, we can help you find those things and build a support network. I don't know about you, Dr. Alexander, but a lot of times my patients haven't told a soul that they're seeking assisted reproduction. So the support network kind of starts with us. Have you noticed that? And your journey is your journey. It's so unique. It's as unique as your eggs. It's every month is going to be different, and every person's month is going to be different. So don't worry about what your friend's journey looked like. When you get your baby in your arms, it's not going to matter what it looked like compared to anybody else's. Okay, I think that's all I have.
Great. Yeah, we got asked a few really interesting questions. A patient has the IUD, and it's the copper Paragard IUD. I think the string is near where the needle goes in, so we always worry about anaerobes of the vagina and infections. So we give an extra week of antibiotics, and that's always helped me. I only occasionally I'll feel like a patient needs to have it removed before egg freezing or IVF, but typically we can actually leave it there. The first month of a Mirena or Skyla or Kylena, you get serum levels through your bloodstream of a production of levonorgestrel or progesterone. And so then that can be suppressive. And so if it's just a new progesterone secreting IUD, we have to wait a little for that system to accept the IUD. But the main thing with your doctor is to take extra antibiotics. I'm a big believer in that. We are not forcing patients or thinking, but some people do have to have it removed. One of the questions I think you could answer too is it says, my husband gets a lot of sun exposure. Will that impact sperm quality? I think that's an interesting question. Do you have any thoughts on that one?
Well, if you just take one step away from there, a lot of sun exposure could lead you to a dehydration situation. So somebody with a lot of sun exposure would certainly want to drink more water and have more electrolytes, but I'm not real concerned about it for sperm quality. In fact, the sun exposure might be better for vitamin D levels. So no,
Yeah.
what do
The
you think?
doxycycline, some men have to take doxycycline to prevent any bacteria from the prostate getting near when the ICSI when
Mhm.
we're fertilizing the egg. And doxy is very sun sensitive, and so will hear of, oh yeah, I laid out and then I got a rash. It's from the doxycycline. So if the doctor's giving your husband or your partner doxycycline, they can't be in the sun too much during that window of time.
Good to know.
What supplements do you recommend prior to the egg retrieval? How long to take them, and what should you stay away from? You want to take that one?
I do like this one. In my clinic, I'm very conservative. What I want you to do about 3 months before the egg retrieval is start a good prenatal vitamin. And there are literally hundreds on the market. So that's something that you would want to talk about with somebody who knows your blood work to tell you which one to take. So a prenatal vitamin. My second one is vitamin D for follicular health. And my third my recommendation would be CoQ10 also for egg health and to give the eggs a little extra energy to make it to blastocyst. So again, conservative, just 3 things: prenatal vitamin, vitamin D3, and CoQ10 in the ubiquinol form. And again, shameless plug, I go over that in my book, and I give you the reasons why you would want to do that in my book. How about you?
I have your book right here. I love it.
Oh,
It's really
good, good. And sometimes people come in and they have bags and bags of supplements, and that's just not necessary. Just go
Yeah.
with basics and feed yourself well with the protein, veg, low sugar berries, olive oil, and some neat seeds and nuts, and follow the Mediterranean diet. And you don't need a whole lot more than that. Now, sometimes in situations like PCOS, your REI might end up giving you something extra in there. What do you think of that, Dr. Alexander?
Yeah, I think it depends on the AMH, the FSH, if the patient has signs of insulin resistance and things like that. Some extra vitamins may help. But some of the vitamins that the men are taking can hinder sperm. So it's good to also it's like too much of a good thing. Everything in moderation. Zinc helps sperm a lot, CoQ10, the vitamin D. But in general, like you mentioned, micronutrients from food is sort of a better way to absorb nutritional benefits and help egg quality and sperm quality as well.
That's right. And the supplements just fill in the gap of what you're not getting in your nutritional profile. And by the time somebody gets to me or gets to you, they have evaluated their diet and they are doing everything they can. So I think diet and these 3 supplements tend to be enough.
Yes, well, thank you so much for joining us today. We wish you a safe and healthy journey. I know the fires made people very stressed out. It was really close to our house, so I feel for everyone who's been affected. I think the beauty of fertility is every month there are good eggs, and we just have to finesse for them to grow. And I think it's important to really feel comfortable with your team, have a good multidisciplinary approach, make sure you're up to date with all your checkups and everything like that. And um I loved what you said, because it is like that good energy and how we even talk to ourselves. That's why I try to break the vicious fear cycle too, even for myself as an older parent. I was like, what if this doesn't happen for me? What if this happens? I kept monitoring most things go normally. And it kind of helped me through my pregnancy, because I was like always a little bit worried, like 3 steps ahead. But I was like, most things go normally. And that really, really saved me during that time period. But wishing you guys all the best. I need a hug and a coffee, so would love to see you. And you're so special. Thank you for joining me today.
You are. I was there on Saturday and I peeked around for you. I was stalking you. I came back to your office twice, but you weren't there. But
Yeah, I think
it
I
was
was here
early.
Sunday or something. But yeah, well, good to see you today. Take care,
You.
everybody. Best wishes.
Best wishes to everybody on your fertility journey, and you can find us both on Instagram. So we'll
Yes.
see you
Take
there.
care. Bye-bye.
Bye, everyone.